Hello, welcome to Tip of the Week. Today we're going to talk about some issues and topics that should be of primary interest to people with strategic responsibilities, although I think there are some facts there that most of you will find interesting. How many people know that most people did not have hospital insurance until after World War II? That's when employers begin to offer insurance as a benefit to get around government-imposed wartime wage and price controls. How many people know that the term healthcare that we use every day today did not come into use until the 1940s? Until then, people spoke of medical care in the hospital or in the physician's office, nursing care, and patient care. How many people know that when people talk about healthcare costs, they're really talking about two separate but related things? Unit cost. This is the cost of a single occasion of service, such as a patient day or a visit to a physician's office. Think of it as a single loaf of bread. Aggregate demand cost. This is the cost of the total number of occasions of service in a given period of time. Think of it as equivalent to the cost of all the loaves of bread consumed in the United States in a given year. So healthcare cost in the United States is calculated by multiplying the average cost of a single occasion of service by the total amount of demand for service. How many people know that at least 40% of total healthcare cost in the United States is actually caused by the third-party payer system, Medicare, Medicaid, Blue Cross, and commercial insurers? The third-party payer system imposes costly administrative requirements on participating physicians and hospitals to control the use of benefits for which insured persons are paying. This drives up unit costs. How many people know that 42% of U.S. primary care physicians believe that patients in their own practice are receiving too much care? Only 6% said they were receiving too little care. How many people know that between 1960 and 2014, the portion of U.S. healthcare expenses paid by consumers decreased from 48% to 11%? The portion paid by government increased from 24% to 49%, and the portion paid by private insurance increased from 21% to 33%. As has been famously said, if you want less of something, you tax it. If you want more of it, you subsidize it. As the consumer-borne share of healthcare expense declined, subsidized demand increased. And the made-up term, healthcare, conflated third-party cost with medical care and hospital service cost, hiding the payment system's primary responsibility for the healthcare cost explosion. How many people know that when the potential consumers of a highly desirable service are shielded from its cost, demand for that service will increase exponentially? The third-party payment system drives up aggregate demand, a fact completely lost on the Centers for Medicare and Medicaid Services, as their completely clueless title on the graph to the right of the screen inadvertently confirms. This subsidized growth in demand, which is entirely the responsibility of the third-party payer system, is responsible for most of the healthcare cost increase in the United States. How many people know that the average 30-year-old person will pay $9,156.38 in premiums and deductibles per year before the third-party payment system pays a penny? How many people know that in any given year, only about 1 out of every 4 Americans will incur medical expenses greater than what they pay for hospital insurance? And if you're under 50, your odds are even better. Approximately 1/2 of those who will incur that much expense are over age 65. For most people under 50, primary care insurance is a bad bet. Most would be better off to save the premium and pay out of pocket. You should, however, maintain coverage to protect against the cost of catastrophic illness or injury. How many people know that in American hospitals, nationally, outpatient activity produced about 12% of patient revenue back in the 1990s? Today, outpatient activity accounts for 60% of patient revenue nationally, and for many smaller hospitals, outpatient care is generating as much as 80% of patient revenue. Much of that remaining hospital-based outpatient care can be performed outside the hospital and is potentially at risk. A rapidly growing number of creative, non-traditional entrepreneurial entities are delivering competitive services, many of them outside of the third-party payer-controlled system. They include retail primary care clinics of the sort operated by CVS and Walmart, concierge medical practices, physical therapy and other rehab centers, freestanding imaging centers, and freestanding surgery centers. You might especially want to Google the Surgery Center of Oklahoma to learn more about what they're up to. These freestanding facilities are often able to severely undercut hospital pricing while offering much more convenient service and uncomplicated inclusive billing. The traditional third-party payer system is rapidly pricing itself out of the primary care market. When the cost of a service outweighs its benefit, consumers of that service will use other options. It's time to consider if your hospital's cost structure positions it to survive and succeed in this emerging new environment. I'm Frank Brady. I hope this tip of the week is useful to you. If I can be of assistance in any way, please call me directly at 816-587-2120. Have a great week, and thank you for watching.